Hi, this is Dr. Ira. It's our second podcast. We'll be talking about diets, different diets, especially prescription diets. There are a lot of commercial diets out there. We have diets for heart disease, kidney disease, liver disease, weight loss. Actually all work very well, but some of the dogs that are very picky eaters will not eat them. You have to really kind of get ones that they like. The different companies have them: Purina, Hills, Royal Canin. Royal Canin seems to be the most palatable of them all. But there is a commercial a company called balance.it.com. You can actually go on the internet and find them. They are veterinary nutritionists, and if you tell them your dog's issues, what the diseases are, and what your dog likes to eat, they will get you a custom made diet that you can make yourself, and it might be easier for you to handle it that way. You can make up the food a week in advance, and then you can give it to them daily. You can use different proteins, different carbs, whatever your dog happens to like. And I do recommend it to a lot of clients, especially the dogs that are kind of picky eaters and they won't eat the commercial diets. The diets for the kidney and for cystic calculi stones, the one trick is, which was taught to me by Dr. Dennis Chu, who's a urologist at Ohio State, if you use CDSD or KD, or any of the other commercial kidney and calculate diets, for every can of wet food you use, you have to add a can of water. For every cup of dry food, you need to add 2 cups of water and let it soak. If you don't, if the crystals are gone and you only give the food without diluting it, the crystals can reoccur within 24 to 48 hours. So it's very important to do that. The raw diet we won't be discussing. I'm not a holistic veterinarian. I am not in favor of the raw diet because of different ways that the diet is pasteurized, and actually people can contract some nasty diseases from it if the dogs lick them or if it's in the feces. But next week I will have Dr. Margie O'Neill on. She is a holistic veterinarian. I worked with her up in North Jersey a number of years ago. She's into all kinds of alternative therapies, and we will be discussing that and the raw diet. The big thing is grain-free diets were very popular at one point. If you give your dogs grain-free diets, they are more prone to getting heart disease from it. So it's very important not to use grain-free diets unless your dog is allergic and you're supplementing them, or you speak to your veterinarian to find out exactly what you need to do as far as the grain-free diets. But they are really not recommended. The There are many diets around, so you have to really kind of try different diets and see how they like it. As far as the commercial diets go, just for dogs without any type of issues, the puppy food and the adult foods all taste the same. The difference is the puppy foods, for the most part, have more calories. So if you're using, for example, Purina 1 on the puppies, you want to use Purina 1 on your adult dogs, because then this way they will transition over to it with really no issues. And that's for any of the commercial diets. As far as giving your dog milk and other treats such as that, they don't have lactase, which makes them lactose intolerant, just like some people do. If you give them milk on a regular basis, if you have milk yourself on a regular basis, you will not have GI issues from it. If you only use it once in a while, then you will. So if you want to give them some milk, yogurt is not a problem, but you need to give it to them on a regular basis. Same thing with table food. You want to watch your table food. If you give them food from the table, don't give a lot of it. Carbs are always good to give. Vegetables are good to give. You want to be careful that you don't give raisins, grapes, chocolate, and other table food that will be very fatty. You do not want to give apple cores, pear cores. Those cores can get stuck in the stomach or the intestines and require surgery. And corn cobs are about the worst. They grab corn cobs at barbecues, they eat them, and next thing you know, you wind up with severe vomiting and diarrhea, and you're looking at surgery. And very often, especially with the corn cobs, they will cause a pressure necrosis or actually destroy the intestines where they're sitting, because they're putting pressure on it and they can't get a blood supply to it. As far as birds go, table food is good for them. Plus, you want to give them their pellets or seeds. But table food is good. When I was treating birds, I recommended that you give them whatever table food they like. They especially like spicy products, hot wings, anything you eat from the table they can eat. They always talk about not giving them avocados. They have to eat a hell of a lot of avocados to cause a problem. So I would stay away from them just in case, but you can give them. If you throw a turkey leg in there or a chicken leg in there, especially to the larger birds, the next morning they'll be stripped clean. Same thing with spare ribs. So try giving your birds table food. In the wild, they don't live on just seeds. They eat berries, bugs, leaves, and everything else they can get. So you really want to give them kind of a diverse diet. So I like to do that with them. One of the other diets, which I'll just back up a little bit, to the commercial diets is DD. It's a dermatology diet. With the dermatology diets, you have to be very strict with it. So if everybody in the house is not on board, you're going to have issues. It takes 6 weeks for the dermatology diets to really start working. If you give any food that is not approved, you'll have to start all over 6 weeks all over again. So if you're in your 4th week and the dog's you're doing pretty good, you go ahead and give them a piece of chicken or meat from the table, and they happen to be allergic to it, then you wind up starting all over again another 6 weeks. So the whole family has to be on board, and that is actually one of the reasons I would send people to balance.it, because you can find out what foods you can make for them and what they can eat from the table that makes it more palatable. You want to be careful with rawhides, bully sticks, and things of that nature. Rawhides are very poor quality protein. We've had dogs choke to death on them. We've had dogs need intestinal surgery. They get stuck in the stomach. They get stuck in the intestines. Bully sticks are just dried bull penises. And again, poor quality protein. They really do like them, but you're going to have a problem if they swallow a large piece. And then again, you might be looking at surgery. I particularly like veggie dents. Veggie dents are really good for their teeth, and it's a compressed vegetable. My dogs were addicted to them. I can hardly even keep them in the house, but they do a great job. And if you have a little bit of tartar on your dog or cat or your dog's teeth, use the veggie dents. They will clean up the teeth very nicely, and it'll probably avoid having to go through a dental. When I was in practice, before I retired, I did not do dentals on a yearly basis. I did it when it was needed. And if it was a little bit of tartar on it, the veggie dents work great. So we don't want to put them under anesthesia. There is always an anesthetic risk, so we want to be very careful. Greenies work well, but we have had instances where the greenies will not dissolve in the stomach. And then again, you're looking at a surgery to get them out. You can give fruit. Again, watch the grapes and raisins, and watch the cores on the fruit. You do not want to give it to them. Same thing again with the corn cobs. I had a client once. I was going through what to give the puppy and what not to give the puppy, and I said, you want to be careful with grapes. And there she interrupted me and said, oh, we don't give grapes. We only give raisins. So one of those things in practice that you always enjoy. And another example was my mother had a boxer that was very allergic, went to the dermatologist. They put her dog on DD, and DD is an incredibly inexpensive diet. So if you can find an alternative, it's always good. I was giving my mother DD from the practice, and one day I was at the house and she's putting meatballs in his dog dish and then putting DD on top. I said, what are you doing? It kind of defeats the purpose. She goes, oh, he won't eat the DD without the meatballs. So at that point, we were done with the DD. So you really have to be very careful with that. A few other things you want to be careful of. You want to make sure if you have a dog that's a fast eater, you're feeding dry food, you might want to add water to it and let it sit in the bowl for a while. It's better to have the dry food expand in the bowl than in the stomach, and otherwise you can wind up with a bloat if they overeat. Also, if they overeat, you want to give small, frequent meals, especially to the larger dogs. You wind up with a gastric torsion, and the gastric torsions can be brutal. It requires emergency surgery. You cannot wait on that. And you want to go ahead and give small, frequent meals. It's not a bad idea to go ahead and add water to the dry food and let it expand in the bowl so you don't have the issues. As far as the diets go, that's pretty much about it. All the diets are good diets. I am a big fan of Purina diets. Purina has been in the country for years. All their foods are made in this country. A lot of dog foods are made out of the country, and they do have some issues with recalls, and you want to take a look and see which foods are recalled and which ones are not. So that's all I really have for that now. Just a synopsis of different foods and different things you can do. Balance.it.com on the internet. Great people to deal with. I really like them. They do a fantastic job, and I would highly recommend that somebody seeks them out if you have any special issues or your dog will not eat the commercial diets or the expenses getting to you. And so if you have any questions, please email me. The email address will be at the bottom of the page, and we will see you next week, hopefully with Dr. O'Neill, and we will be discussing holistic medication. Thank you for listening. Have a great day.